Dr. Amy Mercovich here, posture expert and chiropractor, and we're talking about plantar fasciitis today. So first of all, what is plantar fasciitis? It is heel pain or bottom of the foot pain. Usually people get this middle age and above, but I guess no one's immune. And it's an inflammation of the bottom of the foot, a lot of times where the Achilles attaches to the foot or where this strip of fascia on the bottom of the foot attaches to the heel. It's most often heel pain. Generally, you'd have it in one foot. And a little note here, if you have it in both feet, that is something that you want to see a rheumatologist about, because often bilateral foot pain could indicate some sort of inflammatory arthropathy and not just heel pain caused from the inflammation. So a few things to talk about here. For natural treatments, you've got rest. You need to rest it, because if you keep walking or running on it, you're just going to keep irritating the heel or the bottom of the foot. So you want to rest but not be a couch potato. It may mean switching from walking and running to swimming or using a rowing machine, or possibly pedaling a stationary bike. If you don't have too much pressure on it, will feel okay. So you might need to switch your activity up so you're not just being a couch potato as you rest your foot. Icing is the second thing. It's an inflammation problem, so you want to cool it down. And an easy way to do that is to take a water bottle or a soda bottle that's about this size, and you fill it 2/3 full of water, put it in the freezer with no top on it, then take it out, put the top on it, and now you've got this roller that you can use to roll the bottom of your foot on. You could ice it twice a day for about 10 minutes or so. As far as stretching, there's no magic stretch for plantar fasciitis, and a lot of times people start stretching the heck out of their feet and their calves, and they just start irritating it. So there's no magic stretch, but if you want to do a light stretch, my favorite one for the Achilles and the calf is to go on a stair and just gently press that heel down towards the floor. And remember, there's no magic here, and it's not where you want to keep making it hurt as you're stretching. Just do the light stretch to keep the mobility of your ankles and to stretch out lightly the calf and Achilles tendon, but you don't want to overdo it. Proper gait. So first of all, you want to see my video called Gait Training for Healthy Feet, and that'll talk a lot about the gait and things to do for your feet. But in general, you want good alignment of your spine, you want good movement in your hips and your pelvis, and you want knees and ankles and feet, everything moving properly as you walk. So take a look at that. You want to be walking heel strike, pushing off the big toes. And again, get more information from the other video on that. And then there's two more things. One is to use a splint on your ankle and foot at night. And it's a splint that keeps your foot in extension, so it keeps your toes up. And a lot of people find that it gives them significant relief, and it helps them to heal faster. And again, you can look those up and you can purchase one on your own. They're not expensive. And you would just wear that each night until you feel like you're better. And then lastly, this is one I think of the most effective things you can do, especially if plantar fasciitis has become a chronic thing for you, is to get flexible orthotics in your shoes. So you want to accomplish two things with the orthotics. You want the arch support, so you really want to feel that main arch in your foot when you have that orthotic in there. The second thing is you want cushion. And we use these foot level orthotics that are custom made for you, and we take a mold of your feet with you standing. So we're getting your weight bearing foot. And then the orthotic is constructed based on that. And so you get the arch support and the cushion. You can see there's quite a bit of cushion and they're nice and comfy. So again, natural care for plantar fasciitis. You've got rest, but you don't want to be a couch potato. You want to keep yourself active in something that doesn't bother the foot. You want to ice twice a day, and you can do that by rolling something under your foot that's frozen or just an ice pack. There's no magic stretch, but you can lightly stretch that Achilles on the stairs there, just the back of the calf and Achilles. You want proper gait and alignment of your spine and posture and pelvis in general. You can try a night splint. And lastly, orthotics that are flexible and support the arches and give you some cushion. So hopefully you've gotten a couple good ideas there.